Most people's life stories are lost forever, but yours doesn't have to be. Good evening. Tonight's episode is number 4, and we are fortunate to have Dr. Donald Bachman from Metro West Medical Center. He's on the staff there as a radiologist. Good evening.
Good evening to you.
So to start with, I'd like to go back and discuss your background, where you were born, and let's talk a little bit about your siblings and your life growing up as a child.
Sure. My dad was stationed in Madison, Wisconsin during World War II, so by accident of that, I happened to be born there. But my parents are both dyed-in-the-wool New Yorkers, and right after the war, they moved back there, and I grew up on the east side of Manhattan,
Really?
up through my college career. And both of my parents were physicians. They're both deceased now. There's a photograph of them.
This is a photograph of them?
Yeah, I think that was probably about their 25th anniversary sometime in the mid-'80s. And they met at NYU Medical School. And my mom was one of 2 women in her class of 130, and she had a very distinguished career as a pediatrician, and then in public health. She was director of maternity and newborn services for the New York City Health Department, and she, among other achievements, organized the first transport system for premature babies who were born at primary care hospitals, and in order to get them to intensive care units at the specialty centers, she organized an ambulance with incubators and specially trained attendants to move them. And that dramatically improved the infant mortality for these very small birth weight babies. The other thing she did was New York City, after the Roe versus Wade decision, was one of the first places to offer elective abortions. And although she was not a great fan of abortion as a means of birth control, she took on the task of setting standards for what facilities needed to have for safe performance of these procedures, which procedures could be performed on an outpatient basis, and which were to be performed only in hospitals. Needless to say, she was in the center of a maelstrom about this. The people who were opposed to abortion thought it was awful, and the people who were very liberal on it thought that her standards were too strict. But nonetheless, she had collected fantastic data on maternal mortalities and on infant mortalities before and after imposition of the act. And what it did achieve was that many women who were getting illegal abortions and getting very sick and in many cases dying no longer were having those problems, so that it really was a remarkable achievement. So yes. I'm very proud of my mom. My dad was a diagnostic and therapeutic radiologist in New York for many years. I have one sister. My parents were rather directive about encouraging their offspring to go into medicine, and not by coincidence, both my sister and I are radiologists, and I'm married to a pediatrician. So it's kind of tumbled down from there.
Isn't that that's very interesting that that your parents would be in that kind of a field, and then you would marry into that. Now, where is your sister? This is a picture of you and your sister?
Yes, my sister.
And your mother?
And that's my mom, right? This was after my dad passed away. This was in the early 1990s. My sister and I were both active and are active members of the American College of Radiology. And after you have done a certain number of years as an active member and established achievements by contributing to the field or writing papers or by teaching, they award a fellowship degree, which about 10% of members of the college have. And as it turned out, my sister and I were both awarded fellowship the same year. This was in 1992. And I think it's the only time that a brother and sister have ever been awarded that fellowship at the same time. So I think it pleased my mom to be able to be there for us to get those awards.
She looks very happy in that picture.
Yeah, she lived to be 100 too. She had a good long life, lived by herself up until the end of her life, and she died 2 years ago.
Oh, wow. And she lived by herself till
She
the
did.
very end. That's
We had
amazing.
encouraged her to go into assisted living, and she would have none of it.
So let me ask you too. So you lived in New York. Where on the east side? What was your early childhood like, living with parents who were physicians? And
I had a lot of freedom. In those days, parents didn't helicopter hover over their kids quite so much. I had a bus pass, I had a bicycle, I went all over New York City. Central Park was my playground.
Really?
Sure, I had friends who would go to the park and play football or baseball depending on the season. I got a chance to volunteer at the American Museum of Natural History, and at one point in my life very much wanted to be a paleontologist and go dig up dinosaurs, and at another point wanted to be a mineralogist. It's probably good that my parents were directive, because there were so many things I was interested in doing that it really would have been hard for me to make a decision on my own as to what to pursue. So they, in a way, made it easier for me. Of course, naturally, my sister and I, our first reaction when my parents said, you have to go into medicine, we both went to college and were English majors.
Oh, really?
Yes.
Where did you go to college?
I went to Columbia University in New York.
Uh-huh.
I graduated there in 1965.
Uh-huh.
And afterwards, I became pre-med midway through my junior year and struggled through organic chemistry and managed to get admitted to the medical school at Columbia, which is where I did my medical training. After that, I stayed on. I was a surgical intern, and I did a year of surgical residency there, at which point I decided that general surgery was interesting as a resident, but not what I wanted to do for the rest of my life.
Mm-hmm.
And I had a Berry plan deferment. This was a deferment during the Vietnam era, where people in certain fields could defer their military service until they'd finished training. Once I told them that I was not going to stay in general surgery, they said, okay, you have to come in. And with 2 years of surgical training under my belt, I was perfect for being a triage doctor at a MASH unit or something of that sort.
Oh, did you?
Yeah,
Did you
so I had
actually-
signed up for the Navy, and my assignment was to spend a year on a destroyer in the Gulf of Tonkin, and then a second year with a Marine detachment somewhere near the demilitarized zone. And 2 weeks before I was supposed to ship out, I got a phone call from the detailer in Washington, who said that the destroyer I was supposed to be on had been taken out of action.
Commission.
So I said, great, can I have my training back? So this was one of the kind of funniest things that's ever happened to me. He said, I can't defer you, but I'll give you a choice of where to go. And I have 3 open billets right now. One of them is to be a dive officer on a nuclear submarine. However, you'll have to give me an extra year of commitment because there's a long training period for that. And I explained that I generally slept with my windows open and I'm not sure how a submarine would work out. He said, okay, I have an assignment as a medical officer at our research station in McMurdo Sound in the Antarctic. And I'm thinking to myself—
the Antarctic?
Yes.
Wow.
So I'm thinking 6 weeks there might be interesting, 2 years there might be
A little much.
a little much. So I'm thinking, what possible horrible hellhole is going to be behind door number 3? So he said, and I have a billet at the U.S. Naval Air Station in Bermuda.
Bermuda, wow.
And I said, okay, I think I know what I want to do. And he said, well, this is Friday afternoon. Don't be hasty. Think about it over the weekend. I said, I don't think so. So to make a long story short, I, rather than going to Vietnam, I was in a general medical and surgical practice at the Naval Air Station in Bermuda for 2 years, which was a very nice experience. They wanted me to be able to do OBGYN, so rather than going for basic training and learning how to shoot an M16, I went to the Naval Hospital in Portsmouth Naval Hospital for about a month and delivered a few babies and went to some GYN clinics, so that on the base, one of my duties was to do general gynecology and obstetrical care. So that was for 2 years, and it
Now,
was
were you
nice.
married then? Or
We had just gotten married. My wife had a year to finish her pediatric residency in New York. So the first year there, I was unaccompanied, except for about once a month or every 6 weeks, one of us would fly back and forth.
Mm-hmm.
And then the second year, she came down and stayed, and our first child was born in Bermuda. And we had a little tiny cottage off the base, but it was right on St. David's Island on St. George Sound, so we could jump off the quay in the backyard and jump in the water. And I inherited a small sailboat. I had never sailed before, and
Really?
yeah, I took some sailing lessons. So the biggest ship I was on in the Navy was a 16-footer. And so that was a lot of fun, and I learned a lot of medicine and decided afterwards to come back and do radiology training, and was admitted to the program at Columbia, which was a very fine program. Came back there, and it was a 3-year program, and then I stayed on staff there for several years. And since I had developed a very good relationship with the surgical attendings there, it helped me to develop interventional radiology. This was the era in the late 70s where radiologists were first starting to put catheters into arteries and veins for diagnosis and for treatment. And I did the first 10 angioplasty procedures done in the city of New York. That's where you have a blocked artery and use catheters to clear it and open it up. And the patients who we were given were people who really had no surgical alternatives. And of those, I think it was 4 walked out of the hospital. 3 of them were converted from a below the knee to rather from an above the knee to a below the knee amputation. And the others we didn't really help. But it was a wonderful place to start, and it was a great opportunity. So.
And how that has helped today.
Oh, well, it's
how
expanded.
Exciting.
I mean, that field has expanded to a phenomenal extent. And we were sort of inventing things on a per-case basis. We'd have just a roll of plastic tubing and a steamer to shape catheters to the right positions. In those days, too, this was before we had CAT scans of the body or MRI scans. So we were doing a lot of diagnostic procedures because it was the most accurate tool that we had at the time. And like many other technologies that I've seen in my lifetime that were ingenious and required a great deal of learning, once something else came along that clearly was better, either because it was safer or gave you more information, those technologies were laid aside. And the one lesson I've learned about medicine in general, and certainly about radiology, is the certainty of change, that things are always going to develop, there are always going to be new things on the horizon, and you can't just sit in one place. It's not like becoming an expert on Shakespeare. You have to keep learning, you have to keep studying. The diseases, for the most part of this, are the same, although new diseases have come up. HIV was unknown when I started medicine, and we went through that whole era where it was a fatal disease and now has become treatable. And then most recently, we have the Ebola crisis. Now,
Right.
Ebola as a virus had been around for a while, but this is the first time that it really shows the threat of possibly going to a global epidemic. So it's been a very interesting career.
Yeah, I would say so. So speaking of the career, first I wanted to ask you, you had the one child in Bermuda.
Yes.
And do you have other children or just the one?
No, I have 3 children.
Uh-huh.
The child who was born in Bermuda went to UMass Medical School. She's a surgeon who is now at Fairfax Hospital in Northern Virginia and director of surgical research there, and runs their simulation laboratory where people can go and train for new procedures. And her specialty is complicated hernia repairs. She's very busy, very happy. My younger daughter trained at Michigan and then NYU. She got a graduate degree in behavioral psychology, and she is also in the Washington area. She and her husband live in the northwest section of town, and she works for the U.S. Department of Education doing analysis of research grants and making recommendations for policy change based on the research that is done by the sponsorship of the department.
And what kind of research is it?
Well, this is for education and behavioral things. So,
For, like,
yeah. So in
example?
terms of developing new early education interventions, or
for like students with disabilities, or do it with
partly that.
learning?
Yeah, or let's take as an example, and I'm just inventing this, is it better for a child who comes from another country and doesn't speak English to be integrated immediately into the classroom or very shortly, or to be educated in their native language for the first year and then integrated? It would be that kind of a thing. I don't know if they've actually sponsored that. They probably have, but it's that sort of thing. So
Right.
that's a very interesting job. And her husband works as an aide for the one of the senators from Connecticut. He's interested in public interest communications and comes from a background of public service. They both worked for consumer unions in New York. That's where they met.
Oh.
Then my youngest, Andrew, went to Babson College in Wellesley, majored in entrepreneurship. He's had several companies that he's helped develop and then sell, and most recently is developing a company called Game Plan Nutritionals, and this is health supplements that are provided to personal trainers with potential menus of food and supplements for helping a client with whatever they want to do, whether it's putting on more muscle mass or having more endurance or greater strength training. And it's been going well, and he works very long and hard at helping to develop this company.
Yeah, well, entrepreneurs is a difficult field, but exciting field. And it sounds like where he developed some of your interests that you had when you were younger, too, in making, what you said when you were parentology and all of that. That's interesting, and I think that's an exciting field that all of us are interested in, especially, I mean, not just athletes, but older people, younger people, to learn to have better nutrition.
He's asked me, since one of the things that I'm very interested in is osteoporosis and nutrition.
About that.
He has asked me to look into whether there are some products specifically designed at helping keep older athletes and older people in general healthy and keep their bones and their muscles working well. So that's one of the things I'm planning to help him out with.
Oh, I think that's great. And I know that you were instrumental in getting bone densities to become more for people that are older to get involved in. And if you would like to tell us a little bit about that, I know that you were very responsible for that at Metro West.
Well, this goes back probably 20 years ago. I had a neighbor in Cape Cod, a woman who was an English war bride who was thin, slender lady, bent over while she was gardening one day and felt something crack in her back and had a spontaneous compression fracture of her back. And even though mentally she was fine, this incapacitated her enough that she and her husband had to sell the house, and she really had an unfortunate health course. And it started me thinking about osteoporosis, and this was before there were really good drugs other than vitamin D, and before women taking estrogen was discouraged because of potential cancer risks. And at that time, taking estrogen was the recommended thing to do. But in terms of understanding whether people were at risk or not, you really have to measure what their bone density is. And there is a very simple low-dose X-ray test called a DEXA scanner that can be used to measure it. We didn't have one at Metro West. I pushed really hard for it. The only way I was able to convince the administration to do it initially was to bring a machine in on a trial basis, doing some experiments with it, and then after 6 months they decided to go ahead and buy it. And now DEXA scanners are very common. I have tried to encourage our hospital to develop a multi-specialty osteoporosis service. It hasn't happened yet, but I'll keep trying until it gets done.
I think you should, because I think I notice a lot of women, and they don't exercise, and they have that dowager hump, and it's something that I think could be corrected. And maybe your son, through his nutrition, can come up with additional foods and things that could help that too. That's a great process.
It's been controversial. You know, the big thing that pushed it was after the Merck company came out with Fosamax, they pumped a lot of money into publicity, and the critics said that they invented a disease because they wanted to sell product. Now,
I never heard that.
Yeah, there are naysayers about everything.
Right, but you know that it happens. I
Sure.
mean, I think that's exciting. One thing we didn't talk about, we wanted to show this picture, a couple of pictures. This one is of you and your wife, and she's a pediatrician.
My wife's a
Where's she
pediatrician.
Yeah?
She has had a private practice in Wayland for 30 years. She's getting ready to step out and retire, as am I, and we're looking forward to the next phase of our life, which may be some travel, maybe some overseas benefit work, enjoying our family, and pursuing some hobbies, and just hopefully having some healthy relaxation time ahead of us.
Right. You know, a lot of people wait till they aren't able to enjoy the retirement. So I think
true.
that's. And then we wanted to talk about your latest additions.
Yes.
Now, how many grandchildren do you have?
I have 2, and they were born the same day. That's Ezekiel and Vivian, and they were born to my younger daughter Meredith, and
The one that's in educational?
yes,
Yeah.
and they were born just 1 year ago. Their birthday is October 30th, which also happens to be my birthday.
Oh.
The unfortunate part was that was 4 months before their due date. They were very, very premature. They weighed just over a pound apiece. And the first week after they were born, it really was touch and go. We weren't sure that they were going to make it. They were born at Georgetown Medical Center, and they were in the hospital for, I think, about 3.5 months. And I can't say enough wonderful things about the quality of care that they received. The doctors and nurses there were incredibly dedicated. The technology has really improved, not just with major things, but just knowing very minor adjustments and just being incredibly compulsive about about fluids and oxygen tensions and everything else. But they are a year old and they are doing just great.
Okay,
And,
I think you had another picture, and we'll get it afterwards
Yes.
of that. And we'll show the picture of you as a baby
There you go.
and as of your grandson. That's very exciting. So isn't it kind of ironic that your mother was in that field and pushed for that, and then you ended up having children? There's a lot of irony in your story of life.
I don't know if it's irony. You know, if I were a spiritual person, I'm not sure that I really understand what happens after we go, but if she's in some other place but still in contact, I'm sure she'd be very pleased that the kids were able to do so well, because she was certainly very dedicated to the care of premature infants.
Oh, thank you. Well, that concludes our interview, but I have a couple of other questions for you. I'll have to put an ending on this later. But I wanted to ask you two things. One, you kind of covered it, but maybe there's something you missed. Through all of your years in medicine, what do you feel was the most important thing, that advancement you've seen? And then the second part of the question is, what do you feel is in the future that you would hope to see happen in the medical field?
I'd say in the field of radiology, the development of sectional body imaging has dramatically improved our ability to diagnose diseases and do so with relatively little risk to the patient. And that is CT scanning, MRI scanning, diagnostic ultrasound, and nuclear medicine with PET scans, yes.
Yeah.
And all of them have really developed because of the dramatic development of low-cost, rapid computing power. If we did not have good computers to make the calculations based on these images, none of these technologies ever would have succeeded. So really the development of computers is probably the most seminal change in terms of how we image patients. Certainly there have been wonderful technical developments in many other fields, laparoscopic surgery,
Right.
and you know, things like, for example, the ability to replace a cataract with a normal lens as an outpatient. I mean, that was unheard of. There have been lots of incremental things. The flip side, I'm afraid, that we really need to work on harder is that sometimes the computers and technology get in the way of interaction between individuals, between the doctor and the patient, between doctors and doctors, where instead of having face-to-face conversations, the tail sometimes wags the dog, where the computer has to be the thing. And with electronic data, yeah, it's great that you don't have to decipher somebody's scribbled handwritten notes. On the other hand, when you go to see your doctor, you want them to be looking at you and not looking down, looking at their laptop. So that we really need to change that. I would love to be a spokesperson to try to correct and fine-tune that. It's not that you want to get rid of the computers, they're fantastic, but you want them to be your servant and not your master. And I think that that's something that we really need to work on.
As a patient, I concur. Some doctors that I've been to, they don't talk to you, and you lose that personal feeling. I think that that's really important. So with tonight's episode, we've concluded with the life story of Dr. Donald Bachman, and thank you very much. It was very interesting.
It was my pleasure. Thank you.
Okay, Matt. Done. Thank you. That was very interesting.